Hi, good evening, everyone. Thank you so much for joining us for a very special masterclass on how to relieve pain, heal, and renew with stem cell therapy. We are so excited to share insights on how stem cell therapy can help promote the natural repair of damaged cells, tissues, and organs, reduce pain and inflammation, modulate immunity, and heal degenerative disease. My name is Britt with Forum Health, the first nationwide network of integrative and functional medicine providers. For those of you who are not familiar, Forum Health goes beyond traditional healthcare by combining functional and integrative medicine with advanced treatments and technology, data analytics, and collaborative relationships to offer our patients personalized and transformative results. Our patients have exclusive access to breakthrough treatments, results-driven wellness programs, health content, and a team of experts to partner with you on your journey to a healthy and vibrant life. To learn more, please visit us at forumhealth.com. Also, before we get started, I wanted everyone to know that we will be taking questions at the end of class. Now on to our main event. Our presenter this evening is Dr. Connie Casebolt. Dr. Casebolt is a graduate of Loma Linda University School of Medicine and has been board certified in family medicine since 1985. She has a master's degree in public health with an emphasis in nutrition, and her book, Wellness by Design, has been endorsed by Ellen DeGeneres, Jimmy Kimmel, and Suzanne Summers. Her passion has always been finding and fixing the root cause of disease, which has led her to develop expertise in many functional and integrative treatment modalities. Dr. Casebolt is achieving certification in stem cell therapy from the American Academy of Stem Cell Physicians and is a member of Ozone Without Borders. She's also a very familiar face in Greenville, appearing on local TV talk show Your Carolina with Jack and Megan. Please welcome Dr. Connie Casebolt.
Okay, thank you. And I'm so happy that you all have chosen to attend. I believe I have some wonderful information to present that could actually change your life. So without further ado, I'm going to start advancing the slides and we'll start our seminar. So what is the healing revolution and why do we need it? Well, the future of medicine is actually the future of your personal health. If it doesn't help you, then it's not going to be personal for you. So the problem we face as we get older is that of degeneration. And to degenerate means to deteriorate. This can be physical, it can be mental, it can be both. So you're going into disrepair, falling apart, breaking down. You're actually less than your former self. And the whole reason we degenerate is age. So although we get hopefully wiser as we age, other parts of our body can go south. So to regenerate is the opposite. It means to be able to build, to grow, to repair, or create new tissue. And this is what's so wonderful at birth. And this is why children can heal so quickly. Babies are endowed at birth with this marvelous ability to regenerate. And as you'll see as we progress, this is the thing that we harvest, is this ability of babies to regenerate. So it's really nice to know that the power that created you can help to heal you if you know where to go. So regeneration and healing are actually encoded in our DNA. So our DNA knows what to do, but it's like it starts losing its foot soldiers as time passes. So even though it knows what to do, it can send signals, but if there aren't enough soldiers in the army to follow those signals, then the regeneration doesn't happen. So this is what brings us to stem cells. What are stem cells?
Stem cells are the master cells of the body, the building blocks of tissues and organs. The umbilical cord and the blood left in it at birth contain a broad diversity of pristine newborn stem cells that have demonstrated the ability to help other tissues and organs heal themselves after injury or disease. While researchers have yet to identify every type of newborn stem cell, they have isolated specific stem cells that are the building blocks for other cells and organ tissue throughout the body. Hematopoietic stem cells, found in cord blood, have been used for 20 years to help regenerate the body's blood and immune system. Mesenchymal stem cells, found primarily in the umbilical cord tissue itself, have the ability to help form bone or connective tissues like cartilage and ligaments. Stem cells from the umbilical cord and cord blood have distinct benefits compared to adult stem cells from bone marrow. They're younger, have greater ability to multiply, and have had minimal exposure to environmental factors like viruses or chemicals that can interfere with cell structure and function. But what remains a question is how newborn stem cells work together to help the body heal. Researchers theorize that this diverse population of cells functions like a symphony, each type of cell having a different role to perform in healing damaged tissue and cells. Current research suggests that newborn stem cells help orchestrate a natural repair process by helping to reduce inflammation, stimulate the growth of blood vessels, improve blood flow to injured areas, and ultimately enabling injured cells to repair themselves.
So that was a great little summary of how stem cells work. So we do get our stem cells from a source, umbilical cord, as well as umbilical cord blood. And as you can see, or as you heard, it involves two different types of stem cells, both of which can help the immune system as well as help to actually repair and rebuild actual tissue. So stem cells are really the body's internal repair system. And there's a lot of research that's ongoing. If you were to do a PubMed search on stem cells, you would drown in thousands of articles. There's just so much that's coming to the forefront about the benefits of stem cells. So let's again summarize what stem cells do. They actively seek out degeneration. There's this really amazing, sophisticated communication system to where damaged cells send out like an SOS signal, and stem cells respond to that SOS signal. They migrate to that site, and then they attract repair and building. So they're absolutely wonderful in how they can seek out the degeneration. They're also anti-inflammatory. So inflammation is a huge problem in so many illnesses. And this is where we sometimes use IV stem cells or IV exosomes, which we'll talk about in a bit. They are also immune modulatory. So this can be helpful in autoimmune diseases where the immune system is accidentally attacking part of the body. So all of these ways, stem cells are helping the body to reach a higher level of healing. So the problem is, as we get older, our own stem cells both decrease in number and decline in function as we age. And this is, again, precisely why young children, babies and young children, repair so quickly, whether it's a scratch, a broken bone, whatever, they're going to repair so quickly compared to as we get older. So again, in our younger years, we have large numbers of mesenchymal stem cells, and which can repair all these structures. So a newborn is endowed with 1 out of 10,000. As we get into our teens, it drops to 1 out of 100,000. As we hit even age 30, which seems young to me, it's now down to 1 out of 250,000. Age 50, 1 out of 400,000. And by age 80, there's hardly any stem cells left. So this is one of the reasons you heard earlier. There are stem cell clinics that will harvest stem cell from either fat or bone marrow, but as we get older, they become so few, and also they don't work as well. It's actually easier, less expensive, less painful, because the ability to harvest from your own tissue can involve some discomfort. It's just easier to get those stem cells from products that normally would be thrown away at the birth of a baby. The cord blood and the cord. So again, stem cells theoretically can come from several different sources, and we're going to go through these on the slide. So let's tackle the first hurdle that a lot of people have about stem cells. They think they're illegal. They think they're coming from aborted fetuses or embryos. So just to set your mind at rest, nobody in the US is using this source for stem cells. They're illegal, obviously extremely controversial, fraught with moral issues. It would obviously jeopardize the life of a preborn human, a fetus. So these are not used in stem cell. They might be used in other countries, but not here in the United States. Autologous stem cells are what I've already referred to. This is where the doctor is going to harvest your own stem cells. But again, it involves either a bone marrow aspirate or fat aspirate. There can be complications from this. There could be pain. And these stem cells, although they're probably better than nothing, they're not nearly as potent as the stem cells that we can get from the process that I'll describe in just a bit. So again, the autologous, expensive, invasive, and their quality is really dependent upon the person's age and health. So the stem cells that we use are donated at the birth of a C-section, a planned C-section, from a healthy mother and a healthy baby. The mother has to be below the age of 30. The baby obviously has to be healthy. These are collected at birth during a planned C-section and then very carefully monitored, tested, assayed, every test that they can think of, basically. And the mother herself, this is an act of love because she is donating these. She receives no money for this. She has to fill out about 40 pages of questionnaire. So it's really a very selfless act on the part of the mom to do this. We can get some stem cells from the placenta. However, this is not our preferred choice because there can be a lot of cellular debris, and the placenta could have a little bit more tendency to provoke an allergic response. The concentration of the stem cells is inconsistent. The stem cell count is not verifiable, and there's not really the mesenchymal cells. So this is not a source of our stem cells. Wharton's jelly can be used. This is actually the connective tissue of the umbilical cord. It can be used in joint injections. However, the concentration can be inconsistent. So we're actually using a source that has a combination of cord blood and Wharton's jelly. So you're kind of getting the best benefit of both. So we use that as our stem cells. Now I mentioned the word exosomes. And if you were like me, when I started learning about stem cells, I had never heard the term exosomes. So I'm going to explain that to you. Exosomes are actually harvested from amniotic fluid, again, during a planned C-section. And what they are, they're little tiny, we call them vesicles, which are little tiny packets, if you will, that carry the information that's inside of stem cells. So you can think of them as the actual little workers that are inside stem cells. They have some advantages to stem cells in that they maintain stability at a higher temperature. So we actually have a medical grade freezer here where we keep the temperature, I think it's -100 anyway, it's liquid nitrogen that keeps them medically frozen. If we were dealing just with exosomes, we could actually keep them in a regular freezer and they would not degenerate. So they're a little more hardy, if you will. We use exosomes for multiple uses. We can do it systemic. By that, I mean IV. They can travel throughout the body and be attracted to wherever there could be an injury. So some people will do an IV of exosomes quarterly, every 3 months, just to kind of keep things going. There's an intranasal exosome application, which can help people with different type of brain disorders. So we have seen this benefit conditions like Parkinson's, Alzheimer's dementia, even autism. So that could be helpful. Eye administration, exosomes can actually be injected not into, but around the eye in areas where it can migrate towards the back of the retina and actually improve vision. It's not going to help certain eye conditions, but anything to do with the retina, so macular degeneration, diabetic retinopathy, can probably be helped with this. So I have to take just a second to tell my own story. I have a very, fortunately, early case of macular degeneration on just one eye, my right eye. And I chose to go down to Miami and both learn from and get treatment from Dr. Farshian, who is the head of the American Academy of Stem Cell Physicians. He has been doing stem cells for well over a decade and has many famous clients, his pictures of which line his hallway. So he's been doing this a long time and getting excellent results. He has treated over 125 people with eye disorders, and he's only had one person who did not get an improvement in their vision after he treated them. So I have gone down to Miami periodically. I've now actually gotten 4 treatments from him. And after my 3rd treatment, I saw my ophthalmologist, who told me for the first time in 5 years that my eye was, instead of getting worse every year, which it had been, was now getting better. That was a year ago. And then I had another treatment or a visit with my local ophthalmologist again this past February. And he again told me that my eye had improved even further. So I'm living proof of this eye therapy that we have. We can also use exosomes for, it's part of our hair restoration treatment. We can do it for skin treatments because it's going to help rejuvenate almost anything. So we love exosomes. They have, like I said, a few advantages over stem cells. They're a little more stable. They're also less expensive. They cross the blood-brain barrier, which is why we use them in the intranasal application. So again, we have both types here and love our exosomes. So again, I kind of explained this. You can think of exosomes as the internal soup that's found inside of stem cells. It carries the information found in stem cells. It crosses the blood-brain barrier. Our exosomes have 1 trillion particles per 1.5 cc's, which is a lot, and that's why they are so potent. The stem cells, again, from cord blood, they're undifferentiated. What does that mean? That means that they have the potential to turn into anything. So they're not targeted to become a heart cell or a brain cell or a muscle cell. They're undifferentiated. So endless potential. Also, because they're so young and immature, they are not going to provoke an allergic response in anybody. So we don't have to do tissue testing in order to find out, can someone, benefit from stem cells. It's a simple, fast delivery through injections, multiple uses, knee joints, basically any joint, soft tissue. I've even given stem cells IV and have seen a great response with someone who had a lung disorder. So ours have 25 million per cc, which is a very good concentration. And again, the advantages of using cord blood stem cells and exosomes, we can actually treat anyone because they're not going to provoke any kind of inflammatory response. They're not going to create allergies. They're very anti-inflammatory. They have this great immune modulating capacity, and they can stimulate regeneration. And we can administer them multiple times. So it's not like you're going to ever build up a tolerance or fail to respond. The last time I was in Miami was actually just a few weeks ago. I went to see Dr. Farshian, and in the waiting room was a woman who informed me that Dr. Farshian's stem cells, and we use his stem cells, so I need to give that information. We actually purchase our stem cells directly from him, and so we know that they are just great quality. But she told me that she completely avoided a knee replacement by having Dr. Farshian inject stem cells into her knee. She also told me that her sister, her vision had improved dramatically from macular degeneration after he had done a series of injections around her eye. So she was just profuse with her happiness over the improvements that she and her sister had both seen. So again, intranasal exosomes. This is actually an MRI showing the difference between giving exosomes IV So on the right hand is the intravenous versus intranasal, and how the intranasal administration makes them show up in the brain shortly after administration. So this is why the intranasal is way superior to the IV form if we're trying to get those into the brain. So these can be used for stroke recovery, dementia and Alzheimer's, autism, anything where there's neuroinflammation. I have a colleague, I won't say where, but he doesn't live too far from me. He's a physician and he has Parkinson's, and he has gone for this procedure and told me personally that it gave him remarkable benefits. And I was so happy to hear that. This is actually a picture I took in Dr. Farshian's office. On the left, there's an illustration of a clock drawing from clinic visit number 1 prior to any exosome administration intranasally. So one of the things that we do if we're trying to assess someone's cognitive ability is we can ask them to draw a clock face. And so this woman was told to draw a clock face, and you can see it's rather pathetic. So before exosome, not very good. 1 month later, she can actually draw a much better. It's not perfect, but it's much better than before. And her family was so pleased. This is actually an 82-year-old woman who had some dementia, and her adult children brought her in for treatment, and they were just beyond pleased with her response. So what are people saying about stem cells? And I think, honestly, we had planned to show you a short video at that time. I'm going to just give you a couple of examples, because we had some videos of some testimonials, but they just didn't come through with enough volume that you could have heard them. But I'm going to just tell you a couple. I had a man in this morning, and I put stem cells in his left knee a month ago, and he came in just for me to check on him to see how he was doing. And he was so pleased. He said his knee felt like it was getting permanently better. The pain was gone. It used to be that even if his legs touched at night that they hurt, and that was gone. And he was just thrilled. So he's actually coming back in the near future, and we're going to do stem cells in his back because he's so pleased with how well his knee has responded. I actually love injecting knees because it's an easy injection to do. I know I can get those stem cells right into that space where they need to move around and attract the regenerating ability. And it's just so gratifying to have people get such great results. So again, we can do exosomes IV. So why would people do this? Kind of for overall health. It can stimulate the immune system. It might help regenerate heart and lungs, anti-inflammatory. Central nervous system diseases might be a possibility. Other exosome uses, we talked about hair restoration, facial rejuvenation. We actually have a department of sexual rejuvenation here. We have a vaginal rejuvenation injection and also a penis enhancement injection. We can either use straight PRP, which is platelet-rich plasma, which we harvest from the patient, or we can combine it with exosomes and get even longer lasting and better results. So we actually have an exosome use for sexual rejuvenation. So this is a lady in our clinic. And so each set of pictures, the one to the left is before exosome and PRP. So I should note that we did both. So we did a treatment first with exosomes, and then we followed it with PRP, which we harvested obviously from her vein. And 4 weeks after treatment, you can see there's been quite a dramatic improvement in the thickness of her hair, and she was very pleased with her treatment. So here's another example of hair restoration before and after 2 treatments. And this is an example of this person has moderate arthritis along with a meniscal tear. And 90 days after therapy, you can tell that the joint space has widened. So that dark area between the bones that looks kind of dark, that's actually where cartilage should be. So when the cartilage degenerates, that's what we call bone on bone. If it gets really severe and there's no cartilage left, So cartilage is a little bit like a shock absorber. So that's when people get pain, is if they have degenerated cartilage and they get that bone on bone. So one thing I want to point out is, I mentioned earlier a man who came in just a month ago to get his first. He's already experiencing improvement, and I was really happy for him. I always try to underpromise and overdeliver. So I do tell people it could wait, 60 to 90 days before you actually see benefit. So we don't always see noticeable improvement in the first month, although we usually do, but sometimes it can take a little bit longer to kick in. And seeing this meniscus tear, you heard in the introduction that I am part of the Forum Health community of doctors, and I love learning and listening to the other Forum Health doctors. So I have a colleague out in Salt Lake City, and he is an avid skier. And he normally skis without injury. He has for 20 years, but this winter, he did something to his knee. And I think he got it diagnosed as a torn meniscus. So he's braver than I am. He gave himself a stem cell injection into his knee. And he was reporting to us, his colleagues on the phone, that within basically a few weeks, his knee was feeling so much better. So it's really the proof of the pudding when doctors use these therapies when we doctors use it on ourselves. So here's a very severe bone-on-bone arthritis, and 90 days later, obvious improvement, and also clinical improvement with reduced pain. This is degenerative disc disease, and you can kind of see where those red arrows are showing kind of we call it lipping and just kind of proliferation there. And then the disc space looks better. Everything just looks better. So that's been regenerated, and best of all, that person is less pain. This is before stem cell therapy hip arthritis, 6 months after therapy. And this lady had improved kidney function, and I believe she may have gotten exosomes IV. Now, I want to stop and say, unfortunately, we can never guarantee results. We're likely to get good results, but we can never guarantee good results. But again, the trend, I would say the majority of people are going to get very good results. So again, regenerative medicine, this is no longer brand new. This has been used now for over 2 decades. There have been thousands of successful treatments. Clinicaltrials.gov provides information on over 5,000 clinical trials. You can also go to PubMed and find multiple more thousands studies and articles. I sometimes think that it's the proliferation of clinical trials and research that may have hampered the FDA in moving forward with approving it. So the FDA has not yet approved stem cells for any use that I know of. However, they are closely monitoring things. And Dr. Farshian, who we get our stem cells from, he is actually, he stays in close contact with officials at the FDA just to make sure that, anything he's doing is still not violating any of their standards. So again, wonderful results, lots of research, just not yet FDA approved. So lots of studies are being done, and chronic joint pain, back pain, disc problems, spinal cord injuries, meniscus tears, knee injuries of other sorts. Arthritis is one of our biggest categories. We just get such excellent results, but even tendonitis or even labral tears of the hips, so anything that needs to be regenerated. And this is a really long list. I won't go through all of them, but there's science and research going on. Now, I am in no way suggesting that this could be a substitutive treatment for COVID, but I have heard of instances where people have been given exosomes IV and have made some improvements from COVID. But again, that falls in the realm of still experimental. So I have definitely heard of those instances. So there's a lot coming with stem cells. You can see these articles. There's a paralyzed man that's walking. Apparently, In one case, somebody was able to grow new teeth, lots of things coming. So are stem cells safe? Yes, they're rigorously tested. There are 4 different bodies, federal institutions that require all the paperwork to be done. I alluded earlier to the fact that these women who so generously donate these products have 40 pages to fill out. That's because of these 4 different entities that require paperwork to be done. So they do meet and exceed all current FDA guidelines. And again, the products have been used on thousands of people. So I'd like to tell people, if you're considering an operation or even medication, and let me just bring up the fact that a lot of mainstream physicians are still advocating for steroid, cortisol injections. So cortisone is anti-inflammatory. However, cortisone is like a bad bargain with the devil. It can give you some temporary anti-inflammation benefits, but cortisone injections actually decrease your own stem cells. So they decrease your ability to heal. And so there's even studies that are published in the orthopedic journals showing that the more frequently you get an injection of cortisone into a joint, the faster you're going to progress to surgery, because you're going to start losing your ability to regenerate just from the standard of care medicine of cortisone injections. And I think that is the end of my presentation. So I'm going to ask our moderator if any questions have come in, or if she has any questions for me.
Yes, we have had a lot of questions come in, which is fantastic. Thank you so much, Dr. Casebolt. So let's see, let's dive in here. Are there rejection risks for joint treatment with stem cell therapy?
No, never seen it. Because cells are harvested from these very immature, again, from a being that was a fetus a few seconds before and now is a newborn baby. They're so immature that they do not provoke an immune response.
Okay, that's great to know, because I know that is something that comes up a lot. Yeah. Another question just came in. Is there a risk of an inflammatory response from treating joints with stem cells?
I've never seen that. And again, because we're using an anti-inflammatory medium, the stem cells themselves are so anti-inflammatory that I've never seen that in my practice. And I also have not heard that from other stem cell physicians when we all get together. So I don't think that would be a consideration.
Okay, that's great to know. How quickly does stem cell therapy typically work? And of course, I know everyone's different. What would you say is the average time where people could start seeing results?
Over 50% of the time, when we bring people back a month later, over 50% of the time, they are already getting benefit. They've got a big smile on their face. So that's typical, but they're going to continue to work even up to 6 months later. So let's just say, and I do want to bring up, there are some people who are going to need more than one treatment. I've had more than one treatment on my eye. The lady that I talked to down in the waiting room of Dr. Farshian, she had more than one treatment on her knee. Her sister had more than one treatment on her eye. So I wish it were just one and you're done. But I have to admit that there are going to be some people, and I cannot give you an average, but probably at least 20 to 30% of people are going to need another treatment. But depending, if it's the intranasal exosome for mental improvement, for brain improvement, I would probably recommend doing it every 4 to 8 weeks. If it's a joint, I would probably wait at least 3 months, maybe even longer, to see what kind of maximal improvement you're going to get from the first one before I would embark on a second one. Not that it's going to hurt. I'm just trying to get the most bang for the buck for the patient. Trying to make sure we can get the maximal improvement from the one therapy before we spend money on the next one.
Absolutely, that makes sense. And you kind of touched upon it. A question just came in. Does it hurt? Is there pain involved? And I know people are a little wary with needles, but can you just speak about that? I mean, what do people feel? What does it look like? How long does it take?
Yes. So I've had many people say, you're already finished. With the knee, like I mentioned, I love doing knee injections because I hit so many home runs with knee injections. We're going to put in a little anesthetic first. And so they really don't feel the stem cells because the anesthetic takes effect immediately. So what people have told me is it's far less painful than a steroid shot. And people put up with those all the time. So it's less painful than a steroid shot. When we do the intranasal injection, and I've done this, by the way, back when I was learning it, I was kind of experimenting and I wanted to get some extra practice. So my poor husband has become a forced guinea pig.
He's a guinea pig.
So I did the intranasal on him just to get some extra practice. And he said it didn't hurt at all. And the reason is we take some gauze, we soak it in some lidocaine, which is an anesthetic. We poke it up inside the nose and let it sit there for 10 minutes. So by the time we go to do the injection, it's really not painful. I've only had one person tell me it was painful, and there's that very rare individual that doesn't respond to lidocaine. Lidocaine doesn't numb them. And she told me afterwards that when she went to the dentist, he can't numb her either. So
well, that's a rare case then. That's an unusual case.
It's not very painful. It's over with quickly, and it just really doesn't hurt very much.
Okay, that's a good thing to know because people don't want to experience more pain than what they're already experiencing.
That's right.
So talking about PRP hair restoration, somebody would like to know, with PRP hair restoration, do you have to repeat it on a continued basis with the stem cell injections? So how often do you have to come in? I guess it depends on how much hair loss you're experiencing too.
Yeah, so I could actually do a whole little presentation on hair. When people come in with hair loss, we are going to be a little more comprehensive. We're going to get some labs done because sometimes people are low in minerals, and you have to have minerals to grow hair. Some people are low in thyroid. They might be low in some of the sex hormones. So we're going to do some labs and and also we're going to check for inflammation markers because inflammation can affect this. So we're not going to just immediately jump into a procedure because we have to try to optimize every factor that we possibly can. So we're going to do a little bit of an exam, some labs, and then, correct those factors. We also have some topical things that we use in conjunction with the PRP. But basically, if it looks like the PRP and the exosome treatment is going to be the way to go, we normally do the exosomes with the first treatment. And that kind of lays down the fertilizer. It kind of gets things going in the right direction. So the first treatment, and by the way, we use a very strong numbing cream that we apply to the scalp and let it set for 30 minutes. And we clock it. We have a timer so that we don't rush in too early. Of course, it's going to take us some time to process the PRP anyway. But we do the exosome first, and then we follow it with PRP, and we're just using a little tiny needle. Now, I'm going to say that the PRP is has a little more discomfort than probably any other way that we use PRP, because even with the numbing cream, the scalp can be a little tender. So it's not a walk in the park, but we do it all the time, so people can do it. But typically, we're going to do PRP every 2 months for about 4 treatments. And then after that, people usually need just 1 PR treatment a year to kind of keep it going. So exosomes and PRP for the first, and then the next 3 treatments every 2 months, PRP only, and then typically after that once a year.
That's great. And if you'd like to see before and after photos, Dr. Casebolt has great images on her website, so you can really see. I mean, the results are pretty incredible. Okay, that was great. Let's see some other questions that are coming in. Questions around hips. How risky is it to place stem cells in the hips? And do you have imaging equipment to, I guess, effectively apply the stem cells?
Yeah, it's a good question. We don't have an ultrasound, so we don't have imaging equipment. I know some colleagues that are using imaging. I've gotten pretty proficient at my knowledge of the anatomy of the hip. So the way I do the injection, so there's virtually no risk because I have the patient lying flat on their back. We call that supine. And then I feel for landmarks. I feel for the femoral artery. I feel for the hip bones. And I pretty much know where that hip joint is. And then we just go straight down with our needle, and then we tap on the bone, and we know we're right at the hip joint. Now, the hip joint, just so you know the anatomy, a knee joint is like a hinge. It's just a simple hinge, okay? That's the knee joint. A hip joint is a ball and socket. So you've got this ball that's inside a socket. So it's a little more difficult. You can never get stem cells underneath that socket on top directly of the ball. So you're injecting it, you're tapping on part of it, and then you're hoping that through the process of these injured cells sending out this SOS signal, that it will attract, the stem cells in for healing. So I would say that hips might not respond as quickly as knees, and they might be more prone to requiring another injection. But in terms of risk, there's really no risk. The vital structure in the hip area is the femoral artery. I can palpate that, meaning I can feel that, and I stay well away from the femoral artery. So there's no vital structures that I'm going to hit on the way in.
Right. Okay. That's great to know. Because people are, I guess, have a little hesitancy sometimes with certain procedures like that. So that really clears it up. Just the explanation of how the joints work. Another question that came in involving insurance and how insurance works with stem cell therapy. Can you talk a little bit about that?
Yes. So I'm not aware of any insurances that cover stem cells. We can discuss all day long about how unfair that is. So I think it has to do with the fact that they're being used in so many ways, in so many applications. The FDA just hasn't kept up with things, and insurances by and large are not going to pay for something that's not, FDA approved.
Right.
But I will say this, we have top quality stem cells. We actually offer them at a lower price than our competitors because we would rather treat more people and get them better than have the cost of the stem cells be such a barrier that we can't treat people. We also have medical financing if people can't come up with the sum all at once. And also when you consider, let's just take a knee surgery. If you have a knee replacement or a knee operation, you probably will have some kind of anesthesia. There are risks from that. You might have a big incision with an unsightly scar. You could get addicted to pain medication. If you've got a knee replacement, you could be out of work for 10 weeks. There's a lot of pain with knee replacement. And also with knee replacement, you can never fully bend your knee again. It will not bend the full amount. Right. So the range of motion is going to be a little limited with the flexion aspect, the bending of the knee. You'll be able to straighten your knee, but not bend it all the way. So even though knee replacement surgery has been life-changing for thousands of people, it still carries some risk. And the expense of a stem cell injection is far less than all those expenses of your copay and your time off work. And again, we are substantially less than any other center here in town that does stem cells.
That's great. Any other questions? Well, we have Dr. Casebolt here. This has been wonderful information. If you have any other questions, please submit them now. And that's about all the time we have. So thank you so much, Dr. Casebolt, just for your time, your expertise on this topic, and to everyone who joined us this evening. Also, in the meantime, please visit us at forumhealth.com. Connect with us on Facebook, Instagram, and YouTube. We have a lot of great health content there. But thank you so much and have a great evening, everyone. Take care. Bye-bye.